South Korea is rushing to increase the number of hospital beds as COVID-19 rages out of control. The healthcare system is described as being at breaking point. Just 3 critical care beds are left in the metropolitan region, home to 26 million people, and only 1 left in Seoul.
정부는 환자 수 증가에 따른 의료 체계 부담을 완화하기 위해 병상 확보에 총력을 다하고 있습니다.
Daily infections are expected to hit 1,200 each day soon. The government has acknowledged the current COVID-19 alert level has failed to flatten the curve. They have hinted that more restrictions are on the way. Lim Yun-suk has more.
South Korea's military called the current situation a national emergency as it pledged to mobilize all available resources to help the government's COVID-19 response in the next 3 weeks. The military has sent nearly 1,000 additional soldiers to public health centers amid the rapid rise in new cases.
Now, this is one of the 150 testing centers set up in the greater Seoul area, as the government is urging everyone, whether you have the symptoms or not, to get tested, and it's free of charge.
Braving cold temperatures, many South Koreans are heeding the government's call to get themselves tested. But some experts have criticized this move, saying the priority should be on treating existing COVID-19 patients, as hospitals are running out of beds and the COVID-19 death toll is rising. Authorities say those who succumbed to the virus were mainly people who had pre-existing conditions.
80대, 90대 고령의 환자분들, 치매 환자들, 그다음에 뇌혈관 질환자 중풍, 그다음에 심장 질환, 코로나19에 감염이 되면 초기에는 아무 증상이 없다 하더라도 급격하게 증상이 이제 악화되어서 손을 쓸 수가 없는 그런 상황들로.
As the situation worsens, the government is turning to South Korea's pharmaceutical maker Celltrion's antibody treatment, which they plan to use to treat patients with life-threatening conditions. Celltrion is still conducting second and third phase clinical trials for its CT-P59, but it plans to seek emergency use approval before the end of the year. Health authorities have said it would be administered to the first patients soon, but no details were given. Some experts are calling on the government to impose stricter Level 3 restrictions and shut down at least the greater Seoul area before the pandemic spreads out of control. Lim Yun-suk, CNA, Seoul.